Based on the fact that Nathaniel had both auditory and visual hallucinations, we looked at the psychosis decision-making tree for his provisional diagnosis. He had delusions, hallucinations, disorganized speech, grossly disorganized behavior, and negative symptoms. None of these were due to the direct physiological effects of a general medical condition, nor was it due to the direct effects of substance abuse, medication, street drugs, or toxins. Schizophrenia A criteria was met for 1 month of functioning. Mania or major depression with psychosis was ruled out. The duration was 6 months or longer, which led us to the conclusion of schizophrenia. Our provisional diagnosis for Nathaniel then is schizophrenia. We also diagnosed obsessive compulsive personality disorder. For schizophrenia, he meets the diagnostic criteria. Criteria A for hallucinations, disorganized speech, negative symptoms. Criteria B, his level of functioning in one or more areas such as work, interpersonal relations, or self-care is markedly below the level achieved prior to onset. Criteria C, the signs of his disturbance persisted for at least 6 months. Criteria D, schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out. For obsessive compulsive personality disorder, he has 4 or more of the following. He's preoccupied with details, rules, lists, order, organizations, or schedules to the extent that the major point of the activity is lost. He shows perfectionism that interferes with task completion. For example, is unable to complete a project because of his own overly strict standards are not met. For example, in the movie he dropped out of Juilliard. He's excessively devoted to work and productivity to the exclusion of leisure activities and friendships. Those are also part of his negative symptoms. He's overly conscientious, scrupulous, and inflexible about matters of morality, ethics, or values, not accounted for by cultural or religious identification. For example, he put himself in danger to get a cigarette butt off the street, and he found a bug on his indoor bed. He's reluctant to delegate tasks or to work with others unless they submit to exactly his way of doing things. For example, his relationship with lamp and his reticence to go there. He shows rigidity or stubbornness. Some questions that we'd ask during our assessment about hallucinations are, have you seen visions or other things that other people don't see? What did you see? How long ago did it start? How often do you see it? Have you heard noises or sounds or voices that other people didn't hear? What did you hear? Do the voices seem to come from inside or outside your head? Do the voices ever talk to you about what you're doing or thinking? And do the voices command you to do things? For obsessive compulsive personality disorder, when you have a task to do you often spend so much time getting organized that you have trouble getting the job done? Or when you're working on something, do you often spend so much time on small details that you often lose sight of the main thing that you're trying to do? And some questions that we would ask for ruling out bipolar mood disorder in a manic phase is, have there been times lasting at least several days when you feel high, on top of the world, euphoric, or overly cheery? Have you had periods when you're more energetic or active than usual? What about a period lasting several days when you're unusually irritable and quick to argue or fight? Also looked at Satterley's alternative lenses of assessment for the neurobiological lens. Some research claims that prolonged delay in seeking treatment can result in people being refractory to treatment because of structural neuronal changes. They have measured the association between the time untreated and the subsequent symptoms, cognitive problems, and changes in the brain. This would suggest that Nathaniel may be refractory to treatment given his age and prolonged lack of treatment. A person's risk of developing schizophrenia relies on an interplay between biological, psychological, and social risk factors at individual and ecological levels that interact over time. It may not be only the causation of the disorder, but also the progress and prognosis have a similarly wide-ranging etiology. If we can understand the social, psychological, and biological mechanisms through which untreated psychosis is associated with the outcome, we may find new avenues for improving care for individuals like Nathaniel, as documented in Satterley's alternative lenses of assessment.